and welcome to Political Common Sense for America. I'm Boeheim, the political engineer. And in this 3-minute video, I want to talk about health care reform. Now that's not to be confused with health insurance reform. Two separate issues, and we talk a lot about health insurance reform in a couple other videos. Health care reform is the care you receive from your medical professionals. How can we improve that? How does it need to be improved? Well, first of all, by handling some of the health insurance issues, we deal with some of the health care problems. Because realize that right now there's a lot of defensive medicine going on. There's a lot of extra work and extra churn that happens because of that we can eliminate. We can also deal with it by dealing with the illegal immigration problem, because an awful lot of doctor and nurse care is being put in and used towards illegal immigrants when it should be used for American citizens. But most importantly, we need to change the paradigm from break-fix to pure technology diagnostics. In particular, we are fans of two particular methodologies. One is we need to do DNA and RNA testing and profiling. What this means is everybody's blood and chromosomes are tested to see if they have a propensity for certain illnesses. So for example, if your chromosomes, your DNA and RNA show that you have a propensity for breast cancer, you will be tested more often. If you have a propensity for gallbladder issues in your family, in your history, and in your DNA, you will be tested more often. So we'll be able to catch these issues before they explode into some catastrophic issue that then consumes tremendous amount of dollar and puts you physically at risk. The second thing we need to do is we need to expand our ability to use CAT scans and MRIs and PET scans. In particular, we need to get to the technology level of 256-bit. Right now, we're using 64-bit in most places. Think of it like megapixels. It's like taking a 1 megapixel picture versus a 24 megapixel picture with your camera. The quality is insanely different. With a 128 or a 256-bit scan that we could do once a year, you could literally see molecular change. So you could see the change in cells at such a level before any symptomology came about, and you could deal with it. And this, in my belief, could handle and shift the fight against many cancers and many other issues that we're dealing with.